Welcome back all you fabulous IJustReddit fans. So today we have a question from AskReddit. Sorry in advance for any grossness you might hear. Don't forget to like and subscribe. Let's get it on. Question on AskReddit. Doctors of Reddit, what is the most disgusting thing you've seen on a patient's body? Comment 1. A guy was street racing with his 2-year-old daughter in the back of his car. He rolled the car. Little girl was fine. He, on the other hand, had his arm ripped off. When limbs come off, they're usually severed pretty cleanly in an accident or crushed and need to be amputated. No one in the ER had ever seen one ripped off. It was pretty brutal. Edit, arm was not reattached. Comment 2. Couple from me, couple from my friends. Old lady, like 80, got hit by a car at low speed. Had a penetrating tib fib that tore through the calf muscle, broken hip, and a bunch of other abrasions. In people that age, the mortality rate skyrockets to like 90% inside 12 months when there is a hip fracture, so her quality of life was significantly reduced as a result of that. A heroin addict punctured his eyeball when trying to inject into the corner of his eye. My friend was an intern at that point and apparently it was his spirit killer patient. An older European man tried sounding with a straw from a WD-40 can and tore his urethra on the sharp edge. He was pretty chilled out about it, but his wife wasn't. If you're gonna do some sounding, use a proper instrument with a rounded off tip. And for slam dunk grossness. A young man had visited a sauna, which is Commonwealth slang for a bathhouse where gay men go to have promiscuous sex. This guy had unprotected sex with multiple partners and then freaked out he might have got HIV. So he came into the ER and wanted to get tested. No biggie, right? Well, he was in tears and fearful and had a language barrier, and so he couldn't understand why we didn't need to test the ice cream container full of shite and cum that he'd fished out of his ass. After his sex tirade, and instead could just do a blood draw. Suffice to say, there is no biohazard bag thick enough to dispose of that, and chocolate ice cream was off the shopping list for a few months too. Comment 3. Some of you may know smegma, otherwise known as prick cheese. Was an intern at the time, working at casualty emergency department. In came a male. I don't know if he was homeless or not. He was aged around 50 to 70, can't remember. He couldn't pass urine on his own, so catheter it was. But first the lil man down there had to be cleaned. Here's where the smegma came in. It was thick. Some of you may have it like in clusters. A little bit here and there. No, this guy had it like it was a scarf covering his thing. And the scarf was thick as a rope. You know that typical image of a girl in snowy environment, wearing snow cap and thick scarf encircling her neck. Just imagine that and correlate it with my story. I still remember it because that was my first catheter insertion. I threw my back out because cleaning it took a long time. I think he should have some abrasion with the way I cleaned his lil man. Circumcised or not, clean your thing, guys. Comment 4. In medical school and was doing my rotation in the emergency department. I come in for my shift and the resident sent me into a patient's room to change their wound dressing. Easy enough. So I go in there and I see this dressing is absolutely filthy and smelled terrible. Apparently it had been on her burn wound for over 2 months because she was afraid to touch it. I carefully use saline and start unwrapping the bandage, which caused extreme pain. As I got a couple layers down, I start seeing things move and I thought it was me starting to get lightheaded from the smell, but I looked closer, it was thousands of maggots. Finally got to the skin, cleaned off all the maggots I could see, then returned 30 minutes later to see it covered in maggots again, meaning they had burrowed under the skin. Comment 5. Not a doc, but a former ER nurse. I once had a guy that was brought in after lying on the same side on his apartment floor for about a week. The neighbors called 911 because of the smell. Everything had rotted away to the bone on his hip, and when he moved his legs you could see the joint and ligaments articulate. He was also covered head to toe in scabies. Comment 6. In medical school now, and I had a patient with a hole in their back the size of both of my fists together due to a stage 4 pressure ulcer. I would have been able to touch their spine while we were cleaning the wound if I had been so inclined. We took a massive chunk of necrotic tissue off of this guy, and the fellow I was working with said he would most likely die with the wound because it had gone so far. But nothing I can do can describe the smell. Even through an N95 mask and a surgical mask I was wearing, it was so overpowering that I still have nightmares about it to this day. Comment 7. I am an ENT resident. I saw a gentleman with a history of cancer on his scalp. The ER called because they thought his scalp was infected. Walking in the room, it immediately smelled wretched. When I looked at his head, I did a double take because I saw a patch of his scalp literally move. When I examined closer, I realized that it was a swarm of maggots crawling around his open wound, which was exposed skull. Maybe the maggots actually helped control the infection, I don't know, but I felt very sad for him. Comment 8. In med school I met a gentleman who the world had let down, homeless, disheveled, malodorous, and he wasn't quite there upstairs due to chronic alcohol use. Sweet guy but very confused. He said he came into the ER because his foot hurt. Covered in random scratches and bruises which didn't bother him. We suspected he had significantly reduced sensation from neuropathy. There are different types, e.g. alcoholic neuropathy, diabetic neuropathy. We put on some gloves. I extend his leg while the senior registrar removes his boot, and a chunk of his foot came off with it. Just a big chunk of heel. His foot was covered in necrotic tissue and the smell made my stomach turn. The old boot had been acting like a compression stocking, holding his foot together until it didn't. Comment 9. The pimple was pretty bad. An athletic guy came in because his leg hurt during exercise at first, then at rest too. Nothing to see but a pimple on the thigh, and it felt oddly doughy. The pimple was the exit of a huge abscess. The whole thigh was filled with pus. In the OR, the surgeon dove in with both hands, just hauling masses of pus and dead muscle out. Pilonidal cysts are similarly gross. Large abscesses above the anus from ingrown hair. The holes after cleaning those out vary from golf ball to grapefruit size and need to be tightly packed with gauze every few days so they heal from the bottom up. Takes a while, but they do heal. Homeless people were difficult too. Not that they can help it, it's difficult to keep clean when on the streets. But chasing vermin down the drain with the shower spray at full blast is not fun. I always wanted to scratch my skin off after that. Comment 10. Veterinary, not human, but I'll tell the story of something that came out of my patient's body, because why not? It's not often this story is appropriate to tell. We get a call of a dog on its way in who has eaten the contents of a garbage bin. I was in a big city and had just started working at a new clinic. Reception page to let me know my patient has arrived. I walk out to greet them. We lock eyes. We know each other. This client was a nurse at my last clinic. Client turns bright red. Client, oh no, why are you here? I came to the other side of town so I wouldn't know anyone. Meet, great to see you too. Client, no, I'm sorry but this is so embarrassing. Turns out this naughty dog has eaten the entire contents of the owner's bathroom bin, which was full of old used tampons and pads. I got to spend an hour catching my colleague's week-old used tampons in a tray as her dog vomited them up. So that was a day. Comment 11. During my CNA clinicals, I saw not one but multiple cases of hellacious nursing home neglect. One of the ones that sticks out was this poor woman who had multiple down-to-the-bones bedsores. The entire back of her pelvis was just missing, and you could clearly see her sacrum when changing dressings. Every bit of tissue from her heels was gone too, as was one of her elbows and one of her shoulder blades. She'd been left in the same position for weeks, ignored by the nurses because her illness was so severe she couldn't speak coherently and couldn't move at all on her own. In fact, nurses often snuck into her room to gossip and watch TV on shift, treating her like a piece of furniture that occasionally made noise. One day when I was washing her face and brushing her teeth, her eyes actually focused on me, tracked my movements, and she smiled and tried to wave when I said hello. At that moment I knew she was having at least a semi-lucid moment. How many did she have while her flesh was literally dying on her body and no one cared? The other one was when I saw a post-menopausal patient literally leaving a trail of blood down the hallway, running down her legs. The reason? She had dementia, and part of that was her masturbating frequently, often without noticing who was in the room. The staff at the home had quit trimming her fingernails, hoping the pain and injuries would make her stop. Obviously, this was not the case. I quit working in the medical field after that. Comment 12. Anesthetist here. We were inserting an urinary catheter into an elderly woman. It smelled so foul, like some poor fish had died and been left baking in the sun for days. As the catheter went in, streams of brown pus started leaking out running along the catheter. Turned out to be a really bad UTI. Also necrotizing fasciitis, don't Google it. Comment 13. 20 shite-covered reusable tampons, in someone's rectum. Lady didn't realize they had been going in the wrong hole all this time and thought they would dissolve. After the persistent diarrhea and abdominal pain she decided to come into us. And we went fishing. I'll never forget that adventure. Comment 14. In med school, the absolute worst was a case of Fournier's gangrene, a necrotizing, flesh-eating, bacterial infection of all the soft tissue of the genitalia and pelvis. Wasn't so bad when I first saw him in the ER, but the CT was pretty rough looking. And once we got to the OR and started cutting, no way to describe it. Comment 15. I've seen all those sorts of infected and odorous wounds, but by far the most disgusting and saddest thing I've seen in my career thus far, that green mold that grows on bread and rotting produce. In the ER recently, we peeled off a drunk homeless man's piss jeans to discover that one of his ulcerated legs was growing a lawn of fuzzy green mold. Imagine being so utterly mentally ill and addicted to alcohol that you've lost control over your body to the point that mold colonizes your skin like that. My heart is still broken by such a sight. Comment 16. One guy walked home from a party and ran over train tracks because it was shorter. He got hit by a train and his left arm got ripped off. Not just clean cut, but ripped. To the part where you could exactly see where the vein was snapped. The worst thing was that because he was drunk, climbed back up to get his phone and got hit by another train. That train just ripped both his legs off. We got him, still alive because of the heat and pressure of the train. Your wounds are sealed and he didn't bleed to dead, but damn that sight. One leg ripped off above the knee and one under the knee. He was awake and cooperative and wanted to help move his legs, which he still thought he had. But it was just pieces of meat dangling. The guy actually survived, after a hard battle. Of course without legs and that left arm, but he is an example for everybody. Plays tennis, ping pong, actually graduated. Comment 17. Med student here, saw a guy come into the ER for dressing of a wound on his sole. Wound seemed like your regulation diabetic ulcer around 2 inches across with a whitish floor. Then the resident put 3 of his fingers into the ulcer, and they went right into the man's foot, all the way up to the resident's knuckles. Turns out the floor wasn't the floor at all, but what was left of the inside of that guy's foot. Worst part, the whole time this was happening, guy didn't even so much as wince. No sensation whatsoever. Comment 18. Nurse here, had an infant come in with intussusception, childhood illness where part of the intestines telescope back into itself, causing an obstruction, who was misdiagnosed and sent home. A few days later is rushed back to the hospital via ambulance because his bowel was so obstructed it has become necrotic and he went septic, started to die. Ended up resulting in an extensive bowel resection and abdominal surgeries, and during his stay in the ICU we had what was left of his bowel in a silo bag. A silo bag is essentially a plastic bag that holds the intestines suspended in the air outside of the body. The point is to protect them while outside the body so the inside can heal more effectively. It was like something straight out of Saw 3. The kid ended up making a full recovery. Comment 19. I have to say as a nurse, the necrotic toe the surgeons elected to not amputate but kept saying, if it comes off during a dressing don't stress, was pretty fricked. You know that thing you can do when you bend a finger at the second knuckle and you can wobble the tip. That, but 2 toes. Comment 20. When I worked as a vet assistant, a family boarded the dying golden retriever with us. Dog had multiple tumors, each sitting on the skin maybe 1 centimeter thick and 5 to 10 centimeters diameter, many of which were necrotic and weeping. Whole dog ward smelled like roadkill. Very distressing. Doctors had tried to have the euthanasia talk with the owners several times, but they just loved the dog too much to say goodbye. Thank you so very much for listening. Please check out my other videos and like and subscribe.